For the parent of a child with reactive attachment disorder, these images may be all too familiar.
Reactive attachment disorder, or also known as RAD, is a condition in which an infant or young child does not form a secure, healthy, emotional bond with his or her primary caretakers. There are two types of RAD, one that includes inhibited and the other is disinhibited. Inhibited children show signs and symptoms that may be withdrawn, emotionally unresponsive. They may not show or seek affection from caregivers or others, keeping largely to themselves. Children that are disinhibited may be overly friendly towards strangers. Children with disinhibited RAD symptoms do not prefer their primary caretakers over other people. In most cases, these children act younger than their age and may seek out affection from others in an unsafe way. So it is very important to note the two different types of RAD. Children with RAD might exhibit some of the following signs: unexplained withdrawal, fear, sadness or irritability, sad and listless appearance, not seeking comfort or showing no response when comfort is given, failure to smile, watching others closely but not engaging in social interaction, failing to ask for support or assistance, and failure to reach out when picked up, no interest in playing peekaboo or other interactive games. These signs can occur in other disorders such as autism, so it is important to have your child evaluated to determine the proper diagnosis. It is also important to have your child evaluated because if RAD is left untreated, there may be future complications such as delays in developmental milestones, delays in physical growth, which can be linked to eating difficulties, emotional problems such as depression, anxiety, and anger management issues, eating disorders, drug and alcohol abuse and dependency, trouble in school with learning or behavioral issues, problems in relationships with peers or adults, and potentially later with partners. As a parent of a child with RAD, you may be feeling helpless and unable to form a bond with your child. However, there are impactful interventions you as a parent can do to begin to formulate attachment with your child. Some examples include taking classes or volunteering with children if you lack experience or skill with babies or other children. This may help you learn how to interact in a nurturing manner. Be actively engaged with your child by lots of playing, talking to him or her, making eye contact, and smiling. Learn to interpret your baby's cues, such as different types of cries, so that you can meet his or her needs quickly and effectively. Provide warm, nurturing interaction with your child, such as during feeding, bathing, or changing diapers. Offer both verbal and nonverbal responses to the child's feelings through touch, facial expressions, and tone of voice. What if all the interventions previously described were attempted and none seemed to be successful? Or if your child still appears to be withdrawn or fearful of social interaction? Occupational therapy may be a good resource in addressing deficits in the home, at school, and/or in the community.
Occupational therapy may be an effective intervention for children with RAD, as it has the ability to operate in all areas of occupation that may be affected. In the home, OTs can work with caregivers to create a healthy attachment and encourage bonding through developmentally appropriate childhood occupations. In addition to intervening in the home, occupational therapists may also work at a children's school. In this setting, an occupational therapist would promote social interactions among their peers and support the teachers to create safe and nurturing environments that enhance learning. Occupational therapists also operate within the community setting. Occupational therapists in the community may help to facilitate successful outings and instruction that support bonding, a sense of safety, and foster development for children with reactive attachment disorder that may have stemmed from a traumatic experience. Occupational therapists in this setting may also collaborate and provide services for organizations such as community treatment centers, group homes, residential facilities, and foster care agencies. This is a valuable resource for parents of foster or adopted children who may be in that transitional stage. For parents, reactive attachment disorder can be very defeating. However, evidence has shown that with early intervention and treatment, children are able to build healthy relationships with their caretakers and others. If you suspect your child has reactive attachment disorder, please contact your medical provider.